This is an 11-year-old boy who developed a relatively uncommon complication from a very common summertime problem. Our patient presents with 2 days of ear swelling, and you can see here that there's pretty significant swelling behind the ear, and it's actually pushing the ear forward more toward the face. He went swimming at the beach about 2 weeks ago, and then about a week before started having a little bit of drainage and discomfort from the ear. He saw the pediatrician a couple days before, and they started him on some ear drops to treat possible swimmer's ear or otitis externa, and because they couldn't see the ear canal, they also started some oral antibiotics, some amoxicillin to treat potential otitis media or a normal ear infection. Mom called the pediatrician because the swelling was getting worse, and they told her to come to the emergency department, and I examined him, and I was concerned about something called mastoiditis, which is inflammation and infection in the mastoid cavity, which is some air cells behind the ear that are in the skull. And so I ordered a CT of his mastoids and also some lab work. The CT needs contrast, so we do have to have an IV, and I also gave him some fluids just to kind of flush all that contrast out. So this is going to be his right ear coming into view here. You're going to see a dark area surrounded by a ring of white. So you can see right in here, this is the problem. This is the mastoid. It's nice and open and looks pretty good. He has an abscess right here. The dark stuff is the pus in the middle, and the ring on the outside is the area that the body is walling off. This is called a retroauricular abscess. Retro means behind, auricular is ear related. He also has a lot of swelling around that external canal, that ear canal, so this is likely a complication of a swimmer's ear or otitis externa. Because abscesses are kind of walled off, they need to be opened and drained, and the one to do this would be the ear, nose, and throat doctor, who was my next phone call, and they came to bedside and evaluated him, and they took him actually that afternoon to the operating room and put a drain in and got all of the pus out of this space. They did take a culture, and it ended up being Staph aureus, MSSA, so not MRSA. Otitis externa or swimmer's ear is very common this type of ear because everyone is in the water. It's infection of that outer ear canal. You can have drainage, pain, and swelling. The treatment is drops that go on the inside of the ear, and urgent care, your pediatrician or an emergency department can prescribe it. You can reduce your risk of getting swimmer's ear by drying your ears out after you go swimming and avoiding things like Q-tips and scratching the inside of the ear that can put you more at risk. And a big thank you to this kiddo's family for letting me share his story and these pictures as a learning opportunity for all of us.